I see the picture?
Okay, we're live. Welcome to the KiltzHealth live stream with Dr. Nelson. I am your host, Dr. Nelson. And today we're going to take a deep dive into the heart of male vitality and medical innovation. Yes, thank you. I have my helper here. She's off camera. We're gonna talk about, among other things, about prostate health. Okay, and we have Dr. Lisbeth W, who's gonna be here with us. And I wasn't sure until just a second ago what way of eating she had, and you probably are gonna be happy to hear what she told me. So I'm gonna let her tell you. Go ahead and introduce yourself.
Sure.
Tell us what you do.
Okay.
And which pattern of eating you use. And then we can delve into the prostate and the different problems that we have. By the way, just as a point of reference, I'm not going to ask you, but I am 66. Just turned 66 a couple of weeks ago.
It's great.
Welcome.
I am 61. I eat carnivore. My name is Dr. Lisbeth W. I practice. I'm the founder of Doctor Studio. We focus on root cause of disease and love to help men with prostate issues and sexual issues, since they affect the whole family typically. And I am a carnivore. I've been a carnivore for a long time. It's really a modified carnivore. So I do allow some fruits and vegetables in, but I love that way of eating.
All right. Well, if you have any questions for Dr. Lisbeth, put them in the chat, QQQ in front of it. You may have noticed I'm coming to you from a different spot that I am usually at. I am at the Sarasota Worldwide Studios, Dr. Kilt's house in Sarasota. So that's why I have the black curtains behind me today. All right. So if you have questions, please put them in the chat. I'm going to start with the first question, though. You have stated that the vast majority of prostate diagnoses are missing the mark.
Yeah.
What is the biggest lie or oversight in the standard of care for prostate health today?
I'd call it an oversight. And it is that the reason for an enlarged prostate, the reason for a chronic prostatitis, and typically the reason for most urinary challenges that men experience is chronic prostate infection. This is what we find 99.9% of the time. And these are very complex chronic infections where the bacteria quite frequently comes from the gut and infections in the mouth, infections that most men don't even realize that they have. So chronic infection causing enlarged prostate. Very different from what a conventional approach is.
He's still listening. He has left. He has to leave. But Dr. Kiltz was off camera listening to that, and he kind of preaches the same thing. Everything's coming from the gut. They either go out the bottom or up to the mouth, and basically, not only the prostate, but anything, pelvic inflammatory disease, and any type of inflammation.
That's right.
That probably is the key factor there.
Well, it's a big one. Urologists don't typically test the prostate secretions because for years they tested and the test would be negative because a culture misses most things, right? So we have some very sophisticated testing available. It's simple. It's not crazy expensive, and yet it's very accurate. And so when you have accurate information, it makes the diagnosis and, more important, the treatment more effective. So the urologists and the urology specialty is in complete denial that chronic prostate infection is the reason for benign prostatic hypertrophy. So we just, all these men get labeled with the same diagnosis, just BPH rather. There's nothing benign about it. And they're started on a symptom-focused medication, which I'm not anti-medication in any way, shape, or form. Sometimes you need relief. But if you don't really address the underlying issue, then the problem continues to march on. Before you know it, the medications don't work anymore. And even the procedures that are offered to men are only symptom focused. And what I find is much of the time, the prostate is not even enlarged. So it's not a structural issue. It is a functional issue caused by this persistent low-level infection. So that's the biggest, most important thing that we do, is identify what's really going on so we can dig into fixing.
Most of the time, men come to you because they're, I'm going to say it this way, campy, right? Or either frequency decrease or increase, or just is not coming as we used to many years ago.
Yeah. Well, it really runs the gamut. I think you're in part correct. You know, some men have significant discomfort when they urinate, or they have discomfort after they ejaculate, or they're retaining a lot of urine, and so they have bladder issues as a result, or they're fearful of prostate cancer. And so there's lots of associated reasons why they'll come in, but you know, that's it. Frequent urination, having to get up multiple times in the night, interfering with their sleep. Those are so common, as you know, after men reach 50 or more. Most of your friends have these issues. But we actually are seeing young men in their 20s and 30s now. We have a 19-year-old in our practice who's having prostate issues. And many of the men that we take care of are certainly older than 19, but they've had these problems for decades. So it takes lots of different forms.
The younger population that comes to you, is it mostly either acute symptoms because of what ends up being acute prostatitis, or are they coming because of chronic, you know, they've had the symptoms maybe 3 months or 3 years?
Yeah, they're always chronic when they come to us. We don't take insurance. They don't think of us first. They go to their urologist rather, or their dad's urologist in the younger guys. And the urologist, if he believes that it's an acute prostatitis, they get antibiotics. There's no test. They don't know, really what the bacteria is. And so they get antibiotics. The antibiotics do not typically kill the infection. They'll just drive these bacteria even deeper into the prostate, because these bacteria that are causing these problems are biofilm forming bacteria. They're rarely treated successfully with an oral antibiotic. That being said, the symptoms might go away for a short period of time, even months, but they come back. And they come back because the infection didn't really get treated. And the reason why the infection is able to persist in the prostate is because the prostate tissue is not healthy, and the immune system is not protecting it. So it's a complex issue. And most of the young guys that we take care of, they'll have other associated challenges, allergies, gut issues, things like this, before they'll have a prostate episode. But they never come to us the first time. We're usually the last stop.
What do you think about PSA and using PSA for screening? Just talk to us about PSA.
Well, most of us know that PSA is not a great test, but it's a data point, and it should be recognized as important. I think that, we see the PSA going up and down. It fluctuates often when there's a BPH, when there's an underlying chronic infection. Anything that's going to cause any cellular disruption at all in the prostate is going to affect the PSA. So it leads to a lot of unnecessary testing, unnecessary worry, and that can be problematic. But it is a data point, and I think that if you put it in context, it can be really very helpful. The problem is context, I think, in a urology type of practice. Everybody seems to be painted with the same brush, and that's when these data points become problematic, because if you have an elevated PSA, the first thing that the urologist is typically, of course, I'm generalizing and I'm trying to be fair, but the first thing that's usually recommended is biopsy. And biopsy is not always necessary. In fact, in my practice, it's never necessary because we do very sophisticated blood tests called liquid biopsy. So we can know everything there is needs to know about that cancer with a simple blood test. And I think that that's important to get the word out, because biopsies are often not effective, right? Where either there's a cancer starting and you don't get a piece of it, or there's a cancer starting and it's so early that it doesn't yet look like cancer, or there's infection that then develops after the biopsy. We've had a fair amount of men come in that developed a sepsis after a biopsy, and there can be a lot of complications. So if it's necessary, obviously it's worth a risk, but often it's not necessary, and many of the times it's done because of an elevated PSA, which could be elevated for other reasons. But I don't like this chatter about PSA is useless and we shouldn't do them, because why would you avoid a data point? Why wouldn't you just put it into context? Because it can be very helpful, and a lot of men get the wrong idea and they start to avoid instead of really understanding how these markers can be used.
It is a tool, and like with every tool, you need to know how to use it properly, when to use it properly, and I think that's what it is. Is it a great screening test? No, it's not, but it is useful, especially if you've had one and you are either getting worse or having some new problem. Then you have a data point to compare, right?
That's right. Yep. We use a test that it's a PSMA, or I'm sorry, PSE test, and it's a simple blood test, and it tells us if the prostate cancer genes are actually activated. So in conjunction with the PSA, you can see if you have an elevated risk of cancer. It's 94% accurate, 97% specific, which is pretty darn good. And it's a test that has only been available in the US for a couple of years. And we've been using it right from the very beginning. We actually just did a study with that company and had some very profound findings.
All right. Now, let's talk about one of the main things that you kind of unique, I guess, that you do, this ProstaGen method. Can you explain to us what that is and how do you use it?
I certainly can. We are the only ones in the country, to my knowledge, that are doing this type of work, where we're understanding that there are 7 clinical dysfunctions associated with prostate issues, whether it's a enlarged prostate, chronic prostatitis, and all of those are associated with why a man might develop prostate cancer. So the ProstaGen method is 2 parts. Number 1 part is an assessment process where the patient comes to the office. We collect an expressed prostatic secretion, send that to the lab, see what it is that we grow. We collect blood work that gives us information about these 7 clinical dysfunctions. We do the test that I was referring to, the prostate cancer epigenetic test. And we also, at that same time, because we know that the infection in the prostate is prevalent, most of the time. We inject ozone, medical grade ozone, into the prostate first to start to disrupt the biofilms, and second, to super oxygenate the tissue. And so the first assessment is collecting and starting the treatment. Even the response to the treatment is part of the assessment. We then put men on a lifestyle we call Studio Detox, which is a modified elimination diet. We have targeted supplements to support GI health, hormone health, anti-inflammation, and really start a systemic cleanup. In about 3 or 4 weeks, we come together and we discuss the findings of all of those tests. The second phase of the ProstaGen method is fixing what we find from head to toe. You cannot solve the problems of a chronic prostate issue by just simply looking at the prostate and even trying to fight the infection. You have to go further back and treat all the toxicity that we find molds and metals and chemicals, treat gut dysbiosis, the reason why those gut bacteria escaped the gut anyway and found their way to the prostate, systemic inflammatory issues that lead to lipid issues, right? Cholesterol issues. It's all related. So this is a head-to-toe program that really, it's transformative for men. You have to balance hormones, and that's not just throwing some testosterone at a man. It's literally balancing the hormones, understanding how these hormones metabolize. And when you bring everything into balance, if you need to lose weight, you lose weight. If you need to gain weight, you gain weight. If you're not sleeping well, you start sleeping well. If you have GI issues, those GI issues are solved. And so it's really a lot of fun because we get to see these guys transform. But that's what the ProstaGen method is. It's pretty involved and pretty impactful.
All righty. Well, you're about 2.5 hours from me, I think.
Yeah. It's not a fun drive either.
All right. Let's take a question here. Chris, I am in my 60s. My wife is a really good sport. Should I be concerned? And is there a home check?
I'm glad your wife is a very good sport. These are challenging issues for sure. We can test the prostatic secretions at home. It's you send a semen sample to the lab, and that's a pretty good place to start. But again, it's only one of the 7 clinical dysfunctions associated, but it's a good place to start. If you're having prostate issues, I promise you there's an infection. The problem is, what do you do with that information? Because the urologist only has oral antibiotics to offer you if they're willing, and they likely would in that case, but it's not going to solve the issue. In fact, it makes the issue worse. So it's best to have a full evaluation where you can actually have whatever it is that's found on that evaluation treated appropriately. Otherwise, you're just wasting time, to be perfectly honest with you. And in the last 3 years, there have been several scientific articles written about the gut prostate axis and how it's a new paradigm or a new perspective on prostate cancer. It's what we've known for years. These unchecked biofilm forming complex infections in the prostate cause prostate cancer. It's not a surprise. It's just surprising now that the scientific community is talking about it. The medical community is way behind, probably 10, 15 years behind. And then even when they catch up, they just don't have the tools to fix this type of problem, since it is very complex, since it's head to toe. And our medical industry, if you will, is so siloed. So those are the challenges of any at-home test or any, conventional type of approach. This is the mark on many fronts.
I guess, well, some medications that I commonly use for prostate, may cause a particular problem that's for the audience called retrograde ejaculation,
Yeah.
which would make the test at home difficult.
Well, this is true. This is very true. If your wife is such a good sport, maybe she would do a prostate massage, and then you could just urinate and send that to the lab. So there are other ways of doing it, but yeah, I hear you. Some of these medications can also cause some pretty significant erectile dysfunction. They can cause problems with libido. And again, I am not anti-medication. I think it's wonderful to have symptom relief, but they mask the symptoms, and time goes by without addressing the root cause. And by the time the symptoms now are more significant, the medication doesn't work anymore. Now you're years down the road, and these complications, these infections are even worse. So unfortunately, they delay the game. If you're using them in conjunction with a root cause investigation and a root cause treatment, then it's wonderful. That's what they're intended for, not forever.
As a temporary stopgap while you figure things out.
That's right. They're not used that way, but that is what they are for.
All right. FX Trader asks, and I remind everybody, please put your questions in the chat. And if I miss a question, please put it again. I don't have anyone else here, so I have to be looking at the camera, at the computer, and then I am in a setup I'm not usually at. So you would forgive me if I miss your question, but if we don't bring it up, just put it again, okay? I'll look for that. So FX Trader is asking, what is the percentage of men who develop cancer from an enlarged prostate?
0 men develop cancer from an enlarged prostate. Men who develop cancer have chronic inflammation of their prostate that leads to enlargement. The enlarged prostate itself is a result of that low-level inflammation and that infection that goes untreated. Many men who don't have a large prostate will develop cancer. I mean, we have men where their prostate is perfectly normal size, and yet you wouldn't think so because they have all the symptoms of somebody with a large prostate. I have one gentleman that has a normal size prostate is supposed to be around 30 grams. This gentleman's prostate is 219 grams. It is huge. And yet, when we've gotten rid of his infection and treated him from head to toe, he doesn't have symptoms any longer. So, it's really very interesting. I know I'm not answering your question directly. The percentage of men who
I think it's a very good explanation because what many people think is the enlarged prostate is the direct cause of the cancer.
That's right.
We're saying that the inflammation, which is causing the enlarged prostate, is also the direct cause of the cancer.
That's right. And so it doesn't matter what size prostate you have. If there is unchecked prostate inflammation, you can certainly go on to develop prostate cancer.
Steadfast makes a comment, not a question, but it's, I think, an important comment, fascinating, much more nuance to inflammation. Yeah. So many people I know have had prostate problems.
Yeah. We do a test that the second phase of our program, we dig even deeper, right? So there's more testing as well as treatment done. One of the tests we do looks at the immune system because you're only ever as healthy as your immune system. And inflammation is an immune response. And so when the immune system is stuck in an inflammatory dysfunction, it's a dysregulation, you don't necessarily feel inflamed. You're not swollen. There's nothing that's red. And so you don't realize that you have a systemic inflammation. The immune system is dysregulated. It then leads to an immune suppression. And that doesn't mean that, you're the only one in the neighborhood who doesn't get sick when the virus rolls through, right? That's not what I mean by when someone says, well, I have a real healthy immune system, I don't get sick. It's actually completely opposite. When you get sick is actually your body's immune system that is reacting. So the sniffles, the runny nose, the body aches, that's your immune system reacting and clearing whatever it is that you came in contact with. A lot of people think because they don't get sick that their immune system is healthy. It is quite the opposite. When you don't get sick, it often means that your immune system doesn't have the ability to react, and it's not clearing the infection. And so what happens? That virus comes in, it goes intracellular. It starts to evade the immune system and it drains the immune system. I know that's a little complicated, but we actually have blood tests that just show us, are you stuck in an inflammatory state? Not are you inflamed, but are you stuck in an inflammatory state? Is the immune system suppressed? Are the brakes on in the immune system? Do you even have the necessary antigen presenting cells for your immune system to see a cancer or an infection? And you have to evaluate that. And you can fix that. You can actually reverse that. You can turn back on the immune system by understanding how is it, what's broken, and then how did that happen? And you walk that whole thing back. It's a series of detoxifying. Every single person that we've diagnosed with prostate cancer, every kind of cancer that we've diagnosed, has mold toxicity. And they don't know it because they don't have the typical symptoms that they would think would, your mold toxic symptoms, but they all have aflatoxin on board. And it's very interesting. These are carcinogenic. And so we're all exposed to these things. And the aflatoxin actually is in food. So we're exposed to these things commonly in food. If our immune system is intact and protecting us, then you can't possibly develop cancer. But if your immune system is suppressed and you don't know it because it's been drained from years of chronic low-level infection, then you're just a sitting duck. And this is what we see every day by doing this type of work.
You are in the state of Florida.
Yes.
And obviously, anyone in Florida can see you. But do you see people from other states? Do you do telemedicine?
So most of our patients actually fly in from other places. We've been doing distance medicine, if you will, for 20 years. So always virtual visits, phone calls, video calls, emails. We're very accessible to our patients because this isn't a one and done issue. This is a multi-phase process to really transform. And you have to interact quite frequently in order to do that. And so we only bring people into the office when we need to do procedures.
And if someone wants to get in touch with you, would this be the best place to do that?
That's one place. I think the better place, if it's prostate related, is askdrroy.com. So it's askdrroy.com. And if you go to that website and you put in your information, you'll get more information about what we do. I think that's the best place.
I'm going to put that in the chat for everybody to see.
Great.
And very simple
I
website.
just also want to mention, because I think this is really important for your audience to know, that erection issues and prostate issues go hand in hand. Absolutely go hand in hand. As we start treating men for prostate issues, these infections, their erections will change and get better typically. And so if you're having erection issues, but not necessarily having prostate issues, you may have a prostate infection that you're unaware of.
All right. So this is askdrroy.com, and I put the link in the chat. And if you have questions, please remind you, put them in the chat. There's one question there. I'll bring it up in a second. I do have a question because it's a common thing. Anybody that starts looking into prostate is going to run across DHT, right? And some of the medications that are used work on DHT. So tell us a little bit about DHT. Is it the cause? It's not the cause. We already established that inflammation is the cause, but
yeah, DHT can certainly drive an underlying inflammation, but it's really estrogen that seems to be most challenging for the prostate because it creates an imbalance. It creates a situation that leads itself to more inflammation. So it's really hormone balance that's absolutely necessary. You don't want to drive the DHT down super low. You need DHT for libido. You need DHT for function. So it's all about balancing. We like to feed the top of the steroidogenic hormone pathway, right? You want to be fully respectful of what the body does. So sometimes when you drive your DHT down with a finasteride, for instance, you're masking symptoms, and it might give you some relief, but it's not fixing the problem, and it may actually lead to other issues.
And it's interesting that you mentioned this particular drug. It happens with many drugs in many systems, by the way. Sometimes we prescribe a drug and it has an effect on a hormone system, but we don't bother to check any of the hormones in that system before we go ahead and give it because you're having symptoms, right?
Right. That's the problem with just treating symptoms. It's the same thing with the procedures, right? The TERPs and the steam and the green lasers and all of the PAE, where you're actually blocking blood flow to the prostate. Many of the men that we take care of have already had those procedures, and they are back having problems. Why? Well, because if they received any relief at all, that's great. It's just symptom based. Okay, just symptom based. But the infection and the inflammation continued on. Nobody fixed that. And so eventually, 3 to 5 years later, typically, you have same problems. And not all men get relief because, as I said, I have a gentleman with a 31-gram prostate. It's hardly large at all, and yet he is retaining lots of urine. So it's a functional issue. And his urologist suggested a TERP. What's he going to TERP? I mean, he's got this tiny little prostate, right? So it's challenging if you're just treating symptoms. Very challenging.
Many people will probably know what the term means. TERP, you've mentioned. Yeah. So why don't you explain to us what does that mean?
TERP, green laser, steam, these are all just methods for opening up the urethra. Sometimes it's removing prostate tissue. And again, there are times when that is necessary. I will tell men who are trying to avoid that, I'll get an MRI on the prostate. I can see very clearly that there's a structural issue. And I'll tell them, though we need to get rid of the infection, you may need a procedure to help get relief. We may not be able. So it's removing tissue to open things up. A urolift is opening the urethra. I've had men have urolifts and some of these procedures that now they're incontinent. Very common that there's a retrograde ejaculation associated post these things, which is, it's for some, it's not the end of the world, but I'll tell you, when you're incontinent, it can feel like the end of the world. That's a big deal. It's a very, very big deal.
Brian Dish, 1787, is asking, what are these tests called to have immune system tested?
The test that I use is Immune Frame. It's from a company called RGCC. There's not too many of us doing these tests in this country. It's a company from Greece. Greece, Switzerland, Germany. They've been doing these tests for a long, long time. That's the Immune Frame.
All righty. Please put in the chat. If you're watching on Instagram, I apologize because I don't have access to, even though I started it, and some people may be there, I don't have access to look at your questions. So, all righty. So, let's go back to the beginning that we were talking about hidden infection.
Mhm.
How does it go for so many years undetected? And what are the symptoms men often ignore when they have this infection?
So it goes undetected because the urologists have had very poor testing available. So years ago, if they would do a test, culture didn't pick up these kind of bacteria. Cultures miss about 99% of infection. It's an 1800s technology. Okay. And so if you don't have sensitive testing, you don't realize that it's actually an infection. So what are the symptoms? They're the most common symptoms: urination, urge, frequency. So maybe you have to, pee quite often. I just had a gentleman 2 days ago who every 15 minutes he had to get up to go to the bathroom, and it was just horrible. It doesn't have to be that bad. It can be that you're urinating more frequently. Nighttime, that's when it usually starts. These symptoms usually start having to get up once, maybe twice a night. You should pay attention. That's not normal. Is it common? It's common. It's not normal. You should be able to sleep through the night. If you have to get up early morning because you had lots of water to drink the night before, that's not typically a problem, but it's having to get up multiple times, having trouble starting a stream, feeling a little bit of ache or heaviness, pressure in your prostate, having trouble ejaculating or having pain with ejaculation. I had one gentleman for 40 years. He said every time he ejaculated, it felt like there was a knife that went into his pelvis. And we were able to solve that problem pretty quickly, actually, because we got rid of the infection. We figured out what it was. We got rid of the infection and fixed things up. So it's all the common symptoms associated with BPH. Half the guys on the golf course are, have all these symptoms. And everybody jokes about it. And it's just one of those, your urologist might even tell you, well, you're getting older. As you get older, these things happen. Don't accept that. Don't accept that. I know men in their 80s that don't have any of these problems. So if it were an old issue, then old guys would all have this problem, but it isn't. So.
Is there a link between insulin resistance, which is something many of my friends viewing here are reversing very often with carnivore or very low carbohydrate diets, but is there a link between insulin resistance and BPH, benign prostatic hyperplasia?
Absolutely. Insulin resistance is one of the 7 clinical dysfunctions that are related. That metabolic dysregulation drives that cellular inflammation. So it makes things worse. It's really the cellular terrain that we're looking at here, whether it's in the prostate or the brain or the heart or whatever. It's all the same. It just happens to present itself with these prostate-associated symptoms that are so common in men. But yes, absolutely. Lifestyle is a very big part of the solution to most of these things because this dysregulation drives inflammation.
So let's start with the word fat. For the carnivore curious or carnivore people watching who follow what's basically a high fat diet, how much does it impact the high fat diet on the prostate volume, on the urinary flow, and the symptoms? Because for many years we've had studies saying that high fat diets are actually contributing to prostate cancer.
Yeah. Well, I would say that it depends on the source of fat, right? Not all fat is created equal. It's like not all proteins are created equal. And
But
I think
I use a heart healthy fat. It's called canola oil. I'm just kidding.
I gotta go.
So
Yeah.
go ahead. Go ahead.
Yeah. Even, people who eat carnivore, what, what's the source of that food? Is it a commercially raised animal? Is it a grass-fed animal? Those two things are very different. The fat from a grass-fed, grass-finished animal is very clean and very healthy to the human body. A fat from a commercially raised animal is full of inflammatory cytokines. It's full of toxins. It was raised in a very toxic environment. And so even though you might get some relief from a insulin resistance, for instance, and you're eating commercial beef because you've been able to manipulate some of the biochemistry, you could be accumulating a lot of toxicity from that. So that's a really big question. But clean, healthy fats, avocado, extra virgin coconut oil, even though it's a saturated fat, is very healthy. Good, butter, right? Grass-fed, grass-finished butter, all of those. And a grass-fed, grass-finished beef has higher level of omega-3 fatty acids than the wild-caught salmon. And most people don't realize that. So it's not just what you eat, it's what you ate. What you ate. That's a big deal.
Yeah, sometimes that is very important as well.
Yeah.
So just shifting just a little bit, you've been vocal about the broken system, right? How conventional medicine works. We are really not doing health care. We do sick care.
Yeah.
So what do you think about the system and dealing with prostate symptoms? Is there a cure for that root cause?
Yeah. Well, there's no health in healthcare. It's all very reactive. And, your conventional physician doesn't know any better, to be perfectly honest. There was no education in medical school for wellness. There was no focus on wellness. In fact, in my first year of medical school, after we finished biochemistry, the biochemistry professor threw the book up in the air and said, well, you can forget everything I just taught you. You're on to pharmacology. And that was the truth. Now, my whole life is biochemistry. That's the only way you can fix this thing. It's the manual to the machine. And yet we never think about it again. We're only thinking about pharmacology. Let's name the disease and let's look up the recipe for what medication. I don't do that. I don't care what your disease is called. Doesn't matter. It's inflammation caused by toxins, pathogens. There's a breakdown in the cellular function and cellular terrain, and that's what I focus on. It's not taught. This is not even a common approach yet. I hope that will change. I'm certainly trying to spread the word and help other functional providers get to that place where they really truly understand root cause at its deepest cellular level. But yes, our healthcare system is very broken, very siloed. The GI doctor doesn't know what the cardiologist knows, doesn't know quite how to work with the cardiologist or, the urologist or the dentist or, whatever. And yet, this is all system. We have to look at systems biology, which again is, we're so far from that.
Right.
Yeah.
So I, this past January, 45 years ago, I started medical school, and things have changed, I think, but not for the better. I have to say, uh, because you're quite right about identify something. Let me go to the recipe book. Oh, here's what I'm going to give him. You're out the door, and it feels like nobody ever bothers to try to figure out why
Yeah.
this is happening.
It's funny because every couple of years I need to go to conventional medicine conferences so I can renew my license.
Mhm.
And inevitably somebody asks me, oh, what do you do? And so I give them a short little version. And they say, oh, you practice alternative medicine. And I say, no, actually you do. I know why I'm prescribing what I'm prescribing, how it works, where it works, but you don't much of the time. So we end up having that conversation. But yeah, there's nothing alternative about, not that there's anything wrong with, I think there's room for all kinds of different approaches, energy medicine approaches. There's some incredible technology, but our healthcare system is so far from wellness and really taking into consideration how the body actually works that it's very, very sad. And we're all feeling the results of that.
Definitely, there are many things that we were not taught in medical school. And so at 7.5 years ago, I had a stroke, and something that helped me recover, the biggest chunk of recovery, was pulse electromagnetic fields or frequency.
Yeah.
So I'm obviously, we're carnivore doctors here. And I use the same line sometimes when people say, oh, what you're doing is weird or alternative. No, that's the way we've been eating for thousands of years. You're the vegans and the vegetarians. And yes, you can be fairly successful in keeping your health.
Even though I've never met one.
Huh?
I've never met one who was successful at keeping their health. It's all becomes,
To be not upset people, but most of the people watching here is because they are either carnivore curious, very low carb. But the point being that a carnivore diet, even though it may not have been called that, with a few things added seasonally and locally grown wherever you grew up, that was the mainstream diet, has been for thousands of years. The vegan, vegetarian stuff is the alternative method, right?
We're all genetically hunter-gatherers still. That really hasn't changed. And the quality, unfortunately, of the food has changed dramatically. And I find that that's the challenge. And I joke about vegetarian and vegans, but it really is true. And I think quite frequently it's just so difficult to get what it is that you need anymore from vegetables. And not that I think that's the right way to go, because I do believe that we need all of those amino acids, but I think it's near impossible today.
All right. So there is an epidemic of low testosterone, it seems.
Yeah.
Why do you think that is? It's our environment. Is it, what do you think it is?
Well, I think it's multifactorial. Definitely our environment. We have a lot of endocrine disruptors in our environment. Like I mentioned, molds, metals, chemicals. Many of these are endocrine disruptors. And so they will interfere with normal hormone production. There's also an epidemic of sedentary lifestyle. And that is problematic for a lot of men and women, for that matter, with regard to optimal hormone levels. There's also chronic stress. So I can often see when the body's under chronic stress, when the testosterone levels, let's say it's a 40-year-old male, testosterone levels are that low normal, and yet the pituitary is low normal too. And what that means is they've settled into this little place where this person can just survive. And that is a stressed state. And the body just finds that equilibrium to where we're not pushing this body too much with testosterone. We're reserving resources. You don't want to go and get this person who's under stress to procreate, right? The body's really smart. I mean, we really still are like cavemen and women, and we have to recognize that in our body. So I think those are the three biggest things: chronic stress, sedentary lifestyle, and endocrine disruptors in our environment.
We're coming close to the top of the hour, and we're going to be finishing just before the o'clock mark. But how can a man become his own best advocate when his primary care doctor says, well, your lab's abnormal, so
yeah,
but the man continues to have, either a long list or at least one symptom of anything, but your labs are normal.
Yeah.
I don't know what. Yeah.
I think he has to seek somebody who is outside of that box. We pay for accountants, we pay for attorneys, we pay for trainers, and yet we expect that our broken insurance is going to pay for wellness, and it doesn't. So my question to men is, who are you going to hire to help you live well? You have to think about it that way. What investment are you willing to make? It's going to take money, it's going to take time, it's going to take effort. And if you're willing to put that in, then there are quite a few resources available these days, a lot more than there were 20 years ago. But you have to look at it that way. You have to make an investment. Who are you going to pay to keep you well? I think that's the mindset shift that has to occur. Once you shift that mindset, you'll find some help.
So going back to the carnivore diet, or a meat heavy diet with whatever else you may consume with it, I think in explaining some other things, you did mention this, but I just want to make clear: do you think that will be the best diet to decrease inflammation, insulin resistance, and help improve? It's not a cure-all, but help improve many health conditions.
I do. I see that happen all the time. I think you throw some intermittent fasting in there, throw some coffee enemas and liver gallbladder flushes and things that start to clear some of the toxins, and it is very powerful. Very powerful.
You just mentioned the next question I had for you. You said the word fasting. What do you think about fasting, whether it's time-restricted eating or any fasting, more than 24, 48, or 72 hours?
Yeah.
What do you think?
I like it. I think it's very important. I think it's respecting, where we came from. Like I said previously, we're hunter-gatherers, and that meant we did a lot of fasting. Fasting and finding is really, we were lucky if we were hunting and gathering, but there was a lot of fasting. And so I like to do a 72-hour fast at least once a month. I'm typically in a 16-8 or even 18-6 every day, and a 24-hour fast once a week. Lots of hydration, a lot of good healthy water with some good sea salt, for instance, while you're fasting. I find that it really helps turn a lot of things around. I think an extended fast is excellent. If you can do more than 72 hours, you should from time to time. Yeah, I'm a big fan.
How many times a day do you eat?
Twice.
Twice a day. And okay, that's good. I usually eat once a day, but sometimes I do twice a day.
Yeah.
Last July, by the way, Dr. Kiltz fasted for 15 days. I fasted for 22 days.
Yeah.
We haven't done that, but a day of fasting or 3 days on a regular basis, I think is very good for many reasons, and we won't go over that.
I like data, just not to interrupt you, Dr. Nelson, but I like data. So I put continuous glucose monitors on all my patients. And yeah, there you go. I think it's super important. It doesn't matter whether you have an insulin resistance or not. That's crazy. You want to adjust what is considered the green zone way down to 70 to 100. You don't want to be green for a diabetic. That happens. So you have to understand how to use that tool, but it gives you immediate feedback. And what I found years ago when I started using this tool is you can be eating a carnivore keto diet and bump your blood sugar, and there not even be a single carb in the meal or the snack or the whatever. And when that happens, it's an immune response. It means your body is reactive to that particular food. You might not feel any symptom, but that's a problem. So to get that instant feedback and to understand what's happening, you have people that will fast and their blood sugar spikes all the time, right? They go into a low blood sugar state, body increases the cortisol to start the gluconeogenesis. And so metabolic flexibility is really what you're going for. And so fasting can help you with some of that because you're able to get your body into an autophagy and correct a bunch of things, but you have to do more prolonged fasting to do that.
Do you have a preferred over-the-counter glucose monitor, continuous glucose monitor?
Yeah, I usually just end up using the Freestyle Libre 3 Plus, I think it is. I'm hoping that we'll have better tools and less expensive tools available to us. I think those are coming.
That one is prescription, and then they make the Lingo. That same company makes the Lingo, and Dexcom 7 is prescription. The company makes Stelo. So I'm actually wearing both right now. I have the other one higher because I've been running at just a little bit of an experiment, and they're in the same arm for a reason. Just, it's the closest I can have a good comparison. And one of them is constantly running anywhere from 15, 20, even 30 points higher than the other one. So right now, okay, I had been away from the phone, so they were not registering the very last numbers, but now they are. So as an example, my Lingo says 76. My Stelo says 96. That's always different.
That is significantly different, yeah.
Anyways, I think they might not be perfect, but they're, like we talked at the beginning, it's a useful tool.
Yeah, I think so.
All right. We're really coming up to the top of the hour. Just wanted to show this one more time. This is askdrroy.com. And if you want to get in touch with her, this will be the first place to go. And you can then at some point visit Jupiter, Florida.
Or Boca Raton and Jupiter, Florida, right? Not too far from each other.
I haven't been this spring training, but I go to Port St. Lucie often to watch the New York Mets. Let me see if we have enough. Oh, we don't have time for the last question. Which one is reading higher? Is the photo reading higher? Okay. Well, we're gonna have a Zoom call meeting within the community at 5:30. If you're a member of the KiltzHealth tribe, be there. If you're not a member, sign up. It's completely free. Okay. Thank you, Dr. Roy.
Thanks for having me.
Thank you, everybody.